I'd like to begin by acknowledging funding from the Leonard Davis Institute for Health Economics, which made this work possible. Although many countries in the Africa region have had significantly fewer COVID-19 cases than we've observed in other parts of the world, there's been a lot of concern about the broader impacts that lockdown measures and the global economic slowdown may be having on various indicators of well-being in Africa. And so to examine the impacts of COVID-19, we leveraged an ongoing study we were doing in Kenya and conducted phone surveys with study participants soon after the pandemic began. Our study was conducted in a very high HIV prevalence setting in Kenya, and it focused on low-income women who were highly vulnerable to HIV. There are about 2,000 women who participated in the study, and in the phone surveys we did with women, we asked about various economic outcomes, health outcomes, as well as sexual risk behavior, which we felt was important in order to get an early indication of how the pandemic may be influencing the HIV epidemic in Africa. Let me tell you a little bit about the main findings from our study. Between May and June 2020, we actually reached nearly 85% of the study participants by phone, so about 1,725 women. We found, first and foremost, a significant decline in income for study participants from an average of about $11 per week prior to COVID-19 to a little bit over $5 per week during COVID-19, so a 52% decline in income. And we also found a significant decline in employment hours that was very similar, about 46% fewer hours that participants were working once the pandemic began. Consistent with this decline in economic well-being, we also found very high levels of food insecurity among study participants. So 80% of women reported difficulty obtaining food during the previous month, and 87% worried that at least once during the past month that their household would not have had enough food to eat. And during the previous month, nearly half of the women also reported that they or another household member had gone to sleep hungry at least once due to a lack of food. And then finally, in another dimension of outcomes that we assessed had to do with self-reported sexual behavior. And here we actually find that there's a significant decline in sexual risk behavior, nearly 50% decline in the number of sexual partners that women reported having, both overall as well as transactional sex partners. So in summary, through these phone surveys, that we did in a population of low-income women in Kenya who are highly vulnerable to HIV, we found that the COVID-19 pandemic has actually had a substantial economic impact that has in turn contributed to very high rates of food insecurity. And in the short run, at least, the pandemic has been associated with a decrease in engagement in high-risk sexual risk behaviors that could be driven by social distancing measures as well as a reduced demand for transactional sex in study communities. So the study, we feel, is informing recent as well as ongoing debates over the merits of various policy measures to address COVID-19 in low and middle income countries. It shows that particularly in low and middle income countries where there's high underlying poverty and food insecurity, the COVID-19 mitigation strategies that countries choose may actually lead to considerable deprivation that stems from the decline in income and employment. And this needs to be taken into account when policymakers decide whether to roll out social protection programs to guard against these impacts of COVID-19.